The following is a presentation of Project Independence and WCWP. Project Independence is the Aging in Place initiative of the town of North Hempstead.
Welcome to Project Independence and You.
Good morning and welcome to Community Talk Radio. This is Project Independence and You on LIU Public Radio. I'm your host and producer, Kristina Liu, along with my co-hosts, Otto and Paula Ewell. Paul and I work together at the Department of Services for the Aging, where she's the Deputy Commissioner and I'm the Director of Senior Citizen Affairs. And Otto, volunteer, supporter, friend, the face of Project Independence, I'd say. I mean, I think that just really sums it up.
It's not no funny.
Oh, it's fun being.
I think, well, guys, today we have a jam-packed show because we have two guests. So we need to really get our chops, clear your voices, make sure we're good. We really got to lock in. We have back-to-back guests. But our first guest is the rock star of Project Independence. Yes. I hear his name all the time. People are saying, do you know Barry? Do you know Barry? And I'm talking about the Barry Klitsberg, Assistant Program Coordinator, Nassau County HIICAP Program. And he's here because, I can't believe it, but we are in the season of Medicare open enrollment. So we are going to talk all things Medicare 2026 updates. And Barry, to let you know, this is your 9th time on our show.
Good morning. It's always good to be here. Always good to see you. I do get a lot of calls from people who hear the program.
Great.
So the feedback is great.
Well, I have to say, Barry, and I really, really mean it, all the time. I actually was just at a presentation a couple of days ago, and someone was like, oh, Barry's going to be on the radio show. He's speaking at the advisory. They knew your full schedule, by the way. And I said, yes, he actually will be at all those things. And just a huge thank you for all your support. Yes. And you really are so helpful because, as we all know, the world of Medicare is extremely complex and nobody knows it better than you, Barry. So that's why we need to have you every year on the show. So.
Thank you.
I'd like to thank Barry also because I also refer a lot of people
to
Barry
that's right.
for phone calls, and I've never heard one complaint. I've heard nothing but very positive.
And we get a lot of complaints all the time, right?
I've heard a lot of positive feedback about that Barry gave them great advice. He listened to what their story was, and thank you.
It's a pleasure, and I'm glad that your friends have a resource because so many people don't have a resource, which is why it's important that people call my office when they get questions, especially this time of year, because people are getting all kinds of mail telling them their plan is changing. They're getting mail from marketing companies, which they can ignore if they choose to. It's marketing material. Phone calls. I get phone calls at work from companies saying, I'm from Medicare, which is a scam.
Yes.
And say, oh, we can help you with your lower back pain. Now, if anybody has seen me walk, you can assume I have lower back pain. I get up in the morning and I go, oh. So I know that it's a scam.
That's a good place to start if you think about it. There are two categories of people as I see it, all right? Those who are new into the Medicare world, 64 years old, really don't know what you're talking about as far as the fact that there's a lot of marketing goes on, and they should understand that that's what part of this stuff is. It's marketing. Right. It's not from Medicare. So I think a good explanation as to the difference between what really is Medicare and what is really not Medicare, but a marketing program.
The rule of thumb is this. And I tell people, read your mail. If you get something that has the logo from Centers for Medicare and Medicaid Services, the CMS logo, that's something you should read. If you get something from a plan that you have now, a plan you're doing business with, that's the annual notice of change. Read that because it'll tell you if your current plan still works for you next year. The other thing you should read is anything from Social Security. Social Security and Medicare will never call a person and never ask for their information because they have their Medicare number. They know who they're calling. But if you get a phone call asking you or someone representing Medicare or Social Security, it's a scam. Don't even bother. Right? But if you have business with the government, you'll get something by snail mail, U.S. Postal Service, telling you, and it'll tell you this is an official document. These are your Medicare benefits. These are your Medicare benefits or Social Security benefits for next year. If you have questions, you can call the number that's on this letter. If it's from Medicare, it might have the New York State hotline, which will refer you to me. It'll tell you, what county do you live in? You're in Nassau. All right, we're going to connect you with the Nassau County HIICAP hotline. And usually that rings at my desk. We have other volunteers that will help, but if not, you can always leave a message for me. But read your mail if it's from a company you do business with. If it's marketing material, you can read it. Maybe it helps. Or you can wrap fish with it or line your bird cage with it. But it's not official stuff. It may help, but it's not necessary.
Well, people, I think, like there's two categories that I think would be good for people just to understand from a top level: the Medicare with Medigap, and then Medicare Advantage. Maybe give us a little bit of a.
I'm going to go into that. Yeah. Now, Medicare is for people who are 65 or getting disability for 2 years, or have Lou Gehrig disease or end-stage renal disease, which in English is permanent kidney failure requiring dialysis or a transplant. If you're on Social Security, because you're getting Social Security benefits, early retirement or disability, you will get a Medicare card in the mail automatically, 2 to 3 months before your month of entitlement. If you're not, if you're working at 65 and you want to just take or you're not collecting Social Security, but you're going to be 65, you have to apply. And that you do through Social Security on their website, which is ssa.gov, or you can call their number at 1-800-772-1213. With the government shutdown, I can't speak to how long you'll wait because they have contractors answering the phone, and with the volume that they're getting, if they're answering phones, it may take a while. But online, I always recommend. Right? And then you go into the traditional Medicare system. That's the default. And then you have a choice. You can stay with traditional Medicare with the advantages or the benefits they offer and the costs that are standard, and take a Medicare drug plan, of which there are 10 next year, costs going from $35 and change to $170, depending on the plan, and a supplement called Medigap, which is what you referred to. So, and that gives you a lot of flexibility to go to any doctor or hospital in the country that takes Medicare. Your other choice is to go into a Medicare Advantage plans. These are HMOs, which you need to stay in the network of doctors, and you need a referral to see a specialist. If you go out of the network, they may not cover you.
Right. Me personally, because of discussions with you, and I'm old enough that I've been on Medicare for a little while.
Just a little bit.
Yeah.
Day or so.
That I find I like the feeling of security, if you will, with the Medigap plan or the supplement, one and the same, to be able to go to my doctor of choice without having to worry about getting a referral, without having to worry about getting an approval. Because I have witnessed people go through the approval process where it took a little while to get the approval, and I really don't want to be in that condition or situation. But there are other people that may feel differently because they do package these advantage plans. You get hearing aids, you get whatever, dental,
Vision, dental, hearing.
But the big thing to look into, in my judgment, in that, which I did do, is I have hearing aids. I know what they cost, but you don't get anywhere near that usually in these plans.
Yeah, Medicare doesn't cover hearing aids, routine dental, routine vision. They will cover a disease of the eye, glaucoma, cataracts, but routine things like a refraction or glasses are not covered, which is something that the Advantage plans use as a selling point. They do have some benefit. They vary from plan to plan, so we really have to go into the weeds to see the detail. And that's all available on the Medicare website. But for a lot of people, it's a little intimidating because they're not familiar.
It's overwhelming.
Oh, yeah, sure. So we can look that up for you pretty easily. Now, the PPOs, which are other forms of Advantage plans, you're not limited to the network. You can go out of the network, but you have a higher copay.
Right.
And you don't need a referral to see a specialist. Those are the two big differences between HMO and PPO. They also offer the similar vision, dental, hearing. Some have fitness, telehealth, annual physicals, things that traditional Medicare doesn't cover. And the premiums are much lower than the Medigap plans. So people say, call me, I don't want to pay for it. I believe there are plans with no premium. You're going to pay one way or another when you get health care. Within Medicare Advantage, your big payments may come after a hospitalization, inpatient or outpatient. You're going to pay more than what you would with a Medigap. Physical therapy is an example. With the Medicare plans, Medicare Advantage plans, you may pay $35 to $45 a visit for physical therapy. That's the copay.
Yeah.
With a Medigap, it may be lower or zero.
Ah.
So one way or another, you're going to pay. There's no free health plan.
Yeah, I mean, it lures you in.
Those are incentives to get people to join. And they work for a lot of people because the premiums are low and they get drugs covered through them. They get all those other benefits that Medicare doesn't cover. So when people ask me, what's the best plan? My answer is, what's the best ice cream?
Right.
Yeah. It's what works for you.
Right.
Right. So
Are
we'll
you
help
willing
you.
to gamble?
Right. We'll
It's
help.
more of a gamble, I think,
course.
with the Advantage.
But we'll help the person, and people tell me, I mean, I had a caller this morning. I had 2 surgeries for this disease, and I'm going back next month. And my first thing is, I don't need your medical condition. If you go to the doctor often, that may lead you one way or another. But I don't need to know what the illness is.
Right. Barry, can we back up to like what you do, your agency, and HIICAP? Talk a little bit about HIICAP.
Yeah, HIICAP is a federal funded program through the county and the state. It's like a pass-through. But we're funded by the government to do Medicare and health insurance counseling for people who are 65, going to be 65, or have disabilities, and how to get health care and how to then navigate the Medicare maze.
Okay.
Yeah, we're part of an organization called Family and Children's Association. That's the sponsoring
Excellent
organization.
agency.
Yeah, one of the best.
They do a lot of other senior programs, senior financial, expanded in-home services,
Yep.
stuff for teenagers. But I work in Medicare.
I think it's important for people to understand that there's no charge for this service and that you're not selling anything.
Yeah.
I make no money for coming here
Right.
or selling a plan or going to a senior center. I just do it.
Yeah, I mean, there are a lot of people out there giving advice
Right,
who
for
are
a cost.
advising because they're selling something.
I sell nothing.
Yeah,
I can help somebody sign up for certain plans because we can do that online.
right.
Medigaps, you can't. You got to deal with an agent or a broker because of state law. But any other Medicare-related plan, we can get you into.
Yeah. Do people come to your office typically? You do more work on the phone or?
Most of the work is on the phone, but
Okay.
people do come in.
Yeah.
I get people that say, I got to talk to a person. I have
Right.
to see a face.
Yeah.
So I say, all right, make an appointment
Right.
and we'll try to work you in. But if you come without an appointment, there are no guarantees you'll
Okay.
be seen.
Okay.
So if people are going to come in, please call us.
Yeah.
And that's a perfect thing because I want to let people know that Barry is so graciously doing many programs for us coming up. And October 15th, he will be the speaker at our Project Independence Advisory Committee meeting, which is a great place. You could
Yeah.
really, get to know Barry and ask questions. And I just think it's helpful to hear other people's questions
Absolutely.
too, which, it just might be something you didn't think of.
That's at 10 o'clock, I think.
That's at 10
Yeah.
o'clock. Yep,
Yeah,
at
it's
Clinton
on my-
Park.
it's on my
Good. I'm
schedule.
glad. And then we have
What does it get, 10 minutes?
he's gonna be there for
No, the whole-
the
I
whole
love
the whole
meeting.
shebang. He'll be there. And then what's really great is he had mentioned he works for Family and Children's Association, and they've been doing a lot of our tech assistance. So there's going to be a program that's a dual thing.
wonderful.
So you can get tech help, but Barry will also be there for you to sit with and go over all these things,
excellent.
which is really so incredibly helpful. And that is going to be on November 19th. From 10 a.m. to 2 p.m. He will be at Clinton G. Martin Park.
Got it.
Barry, earlier you mentioned the Medicare drug plan and that there were 10 different ones. I didn't know that like the way I see it is you go online, you put in what your medications are now, and then it'll give you an estimate as to what it is your premiums will be.
It'll tell you
What are
exactly.
the 10 options? I didn't
There are
realize.
10 different plans, down from 12 in New York State. A number of different companies have more than one plan. And that's why there are 4 companies, I think, but they sell 10 plans in New York.
10 different kinds of but there's no like the Medicare gap insurance. There's a plan and
No, they're not standardized. That's part of the problem.
yeah.
So, that's why I feel like a one-arm paper hanger, because if it was standardized, we could say, these are the benefits, these are the costs.
Right.
We could say, this is the plan, these are the costs, but what do you take? When I send out a summary, it's really not useful. I'll send out a worksheet telling people, send this back to me with the names of your drugs, the strength, the quantity, and your pharmacy. And we'll send you back the top 3 drug plans for you based on your specifics.
Right. Now, going
You
back
mentioned
to
that at the advisory.
That's so incredibly
That's huge,
helpful,
yeah.
because it's
well, the Medigap then has letters like Plan N, whatever.
Right.
And I think it's important for people to understand. I'll use company name. If you go through United Healthcare or pick another name,
Emblem.
yeah, the benefits have to be exactly the same.
Anybody who sells Plan N, by law, the benefits are the same.
Right.
So when I send out a sheet of the Medigap plans and their rates, on the one side of the sheet tells you the benefits, and they're standardized, and you pick a benefit level you want. All right, then you say,
well, guys, we're going to have to take a quick break, Otto. Hold all of your questions. We will continue talking with Barry Klitsberg, Assistant Program Coordinator at the Nassau County HIICAP Program, all about Medicare 2026 updates. You're listening to Project Independence and You on LIU Public Radio.
So I get this call from my grandma, and she's like,
"What's a podcast and how much does it cost?"
So I tell her, podcasts are like radio shows, but you can download them on any device and listen to them anywhere at any time, and they're free. And then she says,
"I see, but where can you find good ones?"
And I'm like, go to wcwp.org/podcast and check out the lineup of original shows, or download any podcast app on your phone or tablet and search for LIU Studios. And she's all like,
"Oh, that sounds easy."
And then she asked me what an app is.
LIU Studios podcasts, available on any podcast app. You know, those little button things on your phone screen. Just ask your grandkids.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-host, Paula Ewell and Otto Los. We're diving right back in with Barry Klitsberg, Assistant Program Coordinator with the Nassau County HIICAP Program, all about Medicare 2026 updates. So let's jump back in.
Well, one of the things that strikes me with this thing, I'm going to use Plan N as an example, all right? You could go online and you get exact what the premium is going to be. And it could be, I'll use round numbers, it could be $700 from one company and $400 from another. What I saw, there's a huge difference. So then it comes down to, what is the difference between the $700 one and the $400 one?
Right.
For most people, there is no difference. By law, the benefits are the same. I'm using Plan N. The cheapest plan is $262 a month. Most expensive plan is $514 a month for the identical benefits. Now, sometimes one of those more expensive companies may offer other products. So they may give you a bundle, saying, if you buy our health insurance, we'll give you homeowners cheap.
Oh,
Right,
okay.
bundle it that way.
Right.
Yeah.
That's the only reason I can think of to buy a more expensive Medigap plan.
Yeah.
Okay.
I had, luckily, the company I did work for provides, we used to get insurance, then they got out of the business, but they give you a certain amount of money a month to apply against it. And then there's this whole transaction that takes place between the company and the insurance company. And I found out over the years that one company was a lot better at that than another one. So
Sometimes you go with service.
yeah, that's
In your case, I mean, they may say take a little a plan that's a little more expensive, but we're going to pay for it.
right.
Yeah.
Well, if they're going to pay for it, you may want to go there. And when they stop paying for it,
Yeah, then you
because
got-
of New York state law, you have continuous open enrollment from Medigap. You could switch your Medigap plan any month.
Oh, that's
for
good to
any
know.
reason.
Yeah, that's a thing
That's
that I
great.
didn't have to get through my head for a long time. That really this enrollment period is really very much revolved around the Advantage
Right.
plan. You know, that's where the deadlines come into
And
play.
the drug
And
plan.
the drug
And
plan,
the
right?
drug
Part
plan.
D, yeah.
Now, if I may, we were talking about Medigap before, right? And I was going through
Right.
some comparison,
Mm-hmm.
right? The Medigap plans, like I said, Plan G is the same no matter who sells it. It covers your $20 copay. There's no copay. You just have your deductible for Part B, which this year is $257.
Plan
Part
G.
B.
Plan G does not cover the Part B deductible.
Oh, okay.
Only Plan F does, and you can't buy it anymore.
Right.
They're not selling it to new enrollees. So if you're turning 65 or turn 65 after January 2020, that's not an option. I don't like it anyway. It's not a good value.
I had that in the beginning, and talking with you several years ago,
Remember you
I saved a couple of $1,000s now over
Right.
time.
Yeah, so but there are plans, and people again say, no best plan. How often do you get health care? You don't get health care often, you may want to go one way, a high deductible plan or an end plan, which covers you from day one. Or if you go for treatment once a week, then you want Plan G.
Right.
Because there is no copay, and the copay kind of balances the premium. So people, I have to have a conversation.
Yeah.
And again, I never ask, well, why are you sick? What's your illness? I'll just say, do you get care often? If they say yes, that's subjective. How often? You go once a week? You go once a month?
Right.
Those things will impact. You take a lot of drugs? All right, I'm going to send you a drug plan finder worksheet. We're not going to endorse a company or a product, but we'll tell you the top 3 drug plans overall cost, which includes premium and copay.
That's
Well, I
it's
the drug plans. I did get my
You got your update?
my update, and I'm so far I'm happy with it.
If what you have is staying in the program and you're happy with it, don't change.
Yeah.
Yeah. I mean,
mean-
the rate went up from $38.70
I know the plan.
a month to $42.40.
Right.
Right.
Yeah, it's well calculated.
But I haven't really been paying a lot out of pocket.
Yeah. Inexpensive generics are inexpensive. Some plans now are starting to charge the deductible for generics. They never did before.
Okay.
But that deductible still goes towards the $2,100 cap. This year it's $2,000, next year it's $2,100.
my
Out of pocket cap.
my yearly deductible was $590. Now
Right
it's
now it's going to
$615.
$615.
Right.
But if you take inexpensive generics and they're not charging you for that, or they're waiving the deductible, sometimes the cost is less than the $615, which in those cases, they're not charging you the deductible.
Well, this is as complicated as it can be, too. I mean, there's 6 tiers for drugs.
6, yeah.
There's catastrophic coverage, which this plan it pay nothing when you get into the catastrophic category. There's a lot involved with this stuff too.
After
There's a whole book
2100,
on it.
after 2100, that's what they may be calling catastrophic. Because after 2100, your out of pocket for covered drugs should be 0.
Right.
That's from the Inflation Reduction Act. It was 2000. That does not include premiums. So if you get something from me and the total cost is over 2,100, that means that's the cost of the copays that you pay at the pharmacy plus your premium.
Okay.
Oh, okay.
Makes sense.
I'm sorry, if someone's meeting with you, is there certain information they should gather, or they
How do
they
you
just kind of
prepare?
talk? Yeah, how do you prepare? Right.
First thing I want to see what you have. Show me your current insurance cards.
Okay.
This way I have a baseline for comparison. Then say, all right, what drugs do you take? Go to the pharmacy, get me a printout, because that will give me everything I need, including your pharmacy name. It's because if the pharmacy's in the network, it's cheaper. And if they're preferred in the network, it's even cheaper.
Oh, wow.
So this way, if your pharmacy prints it out, I know who we're dealing with.
Yeah, I mean, like some of them are, if you're CVS or Walgreens.
Like Caremark, this,
Yeah.
different, yeah.
Caremark is CVS mail order.
Okay, oh,
Yeah.
So that's fine.
yeah.
I can put in CVS and then on top, I can write in just mail order. Each plan has their own mail order company.
Is it
Like I
cheap
said,
for mail order? Like what?
Not always.
Okay. interesting.
Sometimes it is,
Yeah.
sometimes it's more
I'm
convenient.
thinking of a homebound people.
Yeah.
Like that's, you know,
The only
They-
problem with mail order is, let's say you go to the doctor and you have an infection
yeah.
and you need an antibiotic quickly. You also need a local pharmacy.
Right, okay.
And the local pharmacy may not know what
They-
mail order is sending you,
Yeah.
especially if you're going to out of Medicare program, like what's Mark Cuban has a program that
Oh,
gives severe discounts.
Yeah, yeah,
Medicare and the Medicare plans don't know that.
right.
So you got to make sure at least your pharmacist knows that you're
Everything.
taking another drug
Right.
to make sure there's no
Not
contraindication.
contraindications,
Like
right.
I've used GoodRx a few times.
That's another example.
Yeah. Does the pharmacy know?
No,
No.
they're not connected.
But see, I
That's
go to
tricky.
GoodRx, I get a printout that says, it's, and I'm not making up numbers. Well, I am making up numbers, but it says $175 if I go through my plan and $35 if I go through GoodRx. So I print out the thing, I bring it to Walgreens, and then I get it for $35.
Because they're billing GoodRx. They're not billing your Medicare drug plan, which is why your Medicare drug plan doesn't know that you have this other drug.
Yeah, I mean, this whole healthcare financing is like a gigantic mystery.
It's a puzzle. It's a patch quilt, and you really need to let your doctor should know what they're prescribing, but they should also know, this pharmacy doesn't know that I'm getting mail order. So they all have to know.
Yeah.
Yeah, I mean, I've told my doctor that such and such costs $500, and is there another option? And yeah, there is another option.
Oh, there are a lot of options. I know I talk to people that go to Canada, and I said, if that works for you, great. But again, remember, Medicare doesn't have a record of that.
Right.
Yeah,
So those are
Importance.
things to really
Yeah.
be concerned with. So, but again, Medigap, they're standard plans. You can switch any month, and there's no network. So any provider that's in the Medicare network or in the Medicare program, Medicare will pay them. And if you have Medigap, Medicare will cross that information over to your Medigap plan, and they will pay their portion automatically.
Now, you provide some kind of analysis of if people do lean toward the advantage direction. My history of that has been you better really read the fine print and see what you're really getting covered, comparing the different plans. But you have already done an evaluation, I think, right?
We have a summary of all of the Medicare Advantage plans in Nassau County.
Right.
It has the plan name, the monthly premium cost, if they have a deductible for healthcare, what you have a copay for primary care, specialist, if they have a drug deductible, and how much you would pay at the hospital, inpatient and outpatient.
Yeah, and if you as a layperson try to figure that all out, it'll take you a long time.
It would take a while. Now, because also I'm familiar with the internet, we can go into each plan
Right.
and get more
Can see
details.
this, right.
So that's why we send this out. And I tell people, and this is what I was going to say before, I tell people, I'll send this out to you, no problem. Your homework is to talk to your healthcare provider, find out if they're in the network of any of these plans.
Right.
So you have a
Right.
better idea
What-
if
Right.
what kind of coverage you would get with them.
right.
Because if they're not in the network with an HMO, you're going to have to pay. If they're out of the network in a preferred provider organization, you have a good idea what you're going to pay higher than in network.
Well, a good example around here, in my opinion, is you have a doctor who's connected with NYU Langone, and all of a sudden you wind up with what used to be ProHealth Optum.
Right.
Some other doctor
Right,
is
right.
with Optum. Do you know whether, I don't know how you know that the one who's in Optum is covered as much as the one,
Right.
you know
What
what I'm
I
saying?
tell people, I frequently tell people, large groups, sometimes some doctors are in, some doctors are out. And if you get an explanation of benefits where they paid a claim, but that doctor's not in, somebody else in the group submitted a claim.
Got it.
That happens.
Okay, that
I've
makes
seen
sense.
that.
Yeah.
Now, there are groups that are not in the plan, and I tell folks, talk to your doctor, see if they're in the plan. You can also look at their website, which may not be quite as current
Right.
as the information the
can
billing
call,
person
right.
has. But at least you get an idea.
Yeah.
Of
Yeah.
what coverage,
Right.
what insurance they take.
Yeah.
Right.
It seems to me when you like when I've had to make appointments recently, they ask you what's your insurance?
First
The
question,
first question, right? And
not
take
whether
it or
are
you
you
don't.
dying,
So like,
no,
right?
what
No,
insurance do
what's
you
the coverage? And they'll tell you right off the bat.
That-
That's if you're making an appointment ahead of time. If
That's-
you're in a
Yeah.
situation where doctors are just coming in to treat, you might not know that.
Right, and
Yeah.
that's why I tell
When
people
it
to
gets
check.
tricky.
But they do. That's the first question they ask. So
Yeah.
when you go to a doctor, make sure you bring your insurance card, your Medicare card, and your Medigap card. Or if you have a different supplement, like an iShip or or an employer plan that supplements Medicare, bring that. Or your Medicare Advantage card, because when they submit a bill, they have to know who to bill.
Right.
And
Right.
on the bill they submit, there's a little box that says Medicare. And after it asks you for the Medicare information. And then, is there other insurance?
Right.
And if you have a Medigap plan and they fill in those boxes, Medicare will automatically send that information to them.
Okay.
So that's why you don't have to pay or get a separate bill
Right.
for your co-insurance, because Medicare automatically gets it.
Barry, how would somebody go about getting that recap of the Advantage plans?
You can call my office.
Yeah, what is that number?
My number is 516-485-3754. And don't ask for additional information. Ask for the summary sheets of the plans. People call and say, I need additional information. And that's kind of vague. I tell them, don't eat soup with a fork. All right? That's vague. But if they say, I need the Medicare summary plans that you people put out every year, we could send them the updated Medigap plans. We could send them the Medicare Advantage
Versus
summary
social
sheet.
workers.
So we could send them a Medicare drug plan finder worksheet to help them pick the best plan. But they call our number, the 516-485-3754, and talk to a live person. We're there every day, and we can help you make an informed choice without endorsing a plan or a company.
Yeah, well, that's the big thing
That's
about
the
it.
best thing.
I mean, to me, the beauty in anything is, can you talk to somebody who really knows what they're doing, who's not trying to sell me?
I know, and Barry, you left because Otto has said to me, I'm trying to find the Barry Klitsberg of blah blah blah. Like, so you just became this
Well,
category.
personal emergency response system.
That's right. Yes.
I would love to be able.
Yeah. He's like, if there was a Barry Klitsberg of the PERS,
Yeah,
it'd be
yeah.
great.
We
Yeah.
have people in our office
Who know
that do
perks.
financial counseling.
Yeah.
What about
family
those? Is the
children's.
personal emergency response system?
Some,
Like, we.
I've seen on a couple of the Medicare Advantage plans,
That they're
they
in
do
there?
offer them.
Really?
This is new. This is a non-covered service. On the summary sheet, it's called ERD, which I had to look up. It says Emergency Response Device. There are at least one plan that has it. I could have sworn I saw it in a couple of places.
And that's new, right, Barry?
This is a new benefit that I've never seen. I've seen it. I got a couple of plans here that do offer that.
Well, that's interesting.
There you go, Otto. See, you just
Well,
brought it.
They changed
I mean,
PERS
they're
to
gonna
ERD.
Use whatever they say you
course.
should use.
Right.
And for those who don't have that, it would be good, and this is off track altogether,
Yeah.
but the Barry Klitsberg of
I
the
know.
ERD world, because there's a lot of,
Yeah.
again, marketing
Yep.
of the
Yep.
different systems.
Look, I've fallen and I can't get up.
Up.
Yeah.
Period.
These, look, I never endorse a product, but some of these products have benefit.
I think they have a
Yeah.
lot of,
I,
personally,
so,
they have a lot of benefits.
and I'm not gonna tell somebody you shouldn't use this.
Yeah.
And I never tell someone not to get any health care.
Right.
It's not covered, or I said, if you need health care, you get the health care you need. And if you can make your arrangements beforehand, we'll try to find you some kind of a plan to cover you. After the fact, it's harder.
Right.
Yeah.
But in many cases, we'll try to find a plan that will work for you before you get the service. But I never tell someone not to get a healthcare service.
Now, when you say get healthcare service, with Medigap or Medicare, whatever precondition you had matters not.
Doesn't make it.
That's the same true with Advantage?
Yes, but especially in New York, but they can impose, they are more restrictive.
Okay.
I'm just going to give you the general rule. All right. Medicare plans are more restrictive. HMO, certainly. Okay. If you're new to Medicare, there's no pre-existing condition. If you had other coverage, there's no pre-existing condition.
Right.
Well, after the break, we will continue talking with Barry Klitsberg, Assistant Program Coordinator, Nassau County HIICAP Program, all about Medicare 2026 updates. You're listening to Project Independence and You on LIU Public Radio.
Take WCWP with you wherever you go with the WCWP app. Listen live 24/7 to all of our streams, all from one app. Plus, call the studios directly from the app and visit our social media. Download the app through the iOS App Store on Apple devices or the Google Play Store on Android by searching WCWP Radio, or visit WCWP.org for links. The WCWP app, available now on iOS and Android devices.
Welcome back to Project Independence and You on LIU Public Radio. I'm your host, Kristina Liu, along with my co-hosts today, Paula Ewell and Otto Lose. And we're jumping in with Barry Klitsberg, Assistant Program Coordinator, Nassau County HIICAP Program, about all things Medicare. I mean, Barry, we could literally talk to you forever. It literally flies by every time.
You wouldn't think there's that much.
No, it's just, you know what it is? But this just shows that you need to, and it's beneficial to sit down with Barry to go over this. You know, it is a free service. And what we have learned is that it's such an individual process.
Yes.
You know, so what Otto's getting isn't going to work for me or for Dan or for Paul, you know, so it's, I think it's really important to see what, you know, is best for you. And you can save so much money. I mean, I've had conversations with Otto offline and, you know, you talked about it, how much you saved, you know, by switching plans, you know, many years ago. So
I did a lot.
And we all could certainly do that in nowadays. So
Now, this is not a political show, but I'm going to bring up a topic that's kind of on people's minds right now. The Affordable Care Act is under shaky area right now, unknown, basically. What kind of impact would that or could that have on Medicare, Medigap, or Medicare Advantage plans, if any?
Well, for Medicare, it's highly technical based on some of the aspects of pre-existing laws. If with the budget bill that was passed a few months ago, if the debt goes higher than a certain amount, there's an automatic kick point where Medicare reimbursement to providers could be lower. It's transparent to beneficiaries. That's the biggest Medicare impact that I see. But other programs like the Affordable Care Act tax subsidy, which is really a premium support for people that have insurance under the Affordable Care Act, and their premiums are being supported.
Now, would that apply
That could change. Those supports could be reduced or eliminated
Oh, wow.
under
That's
the new
significant.
budget proposal. And if that happens, people who have insurance through the Affordable Care Act, the New York State of Health Exchange, they could see their premiums go up. And I've seen estimates 17 to 300%. Depends on who you listen to.
Right.
I haven't seen, since nothing has formally been passed,
Right.
we haven't seen new rates. By just, you know, you listen to the commentators on TV and you hear all these different numbers. We know they'll go up. We don't know how much.
Yeah, unfortunately, as we all know, depends on the slant that the commentator may want to put on it,
Right.
depending on what team he's on. And that's unfortunate that it's like that, but that's how the way it is.
That's the world we live in. But
Yes.
those are some of the big impacts of the budget negotiations that are going on now. Okay, we don't need to go into the weeds on a lot of things. I tell people again, be informed.
Right.
Be informed, read the papers. If you can find something that's nonpartisan, Great news. Read that. Because that will probably give you the best summary. Unfortunately, a lot of the stuff coming out of Washington on official websites now has a political slant.
Yeah.
So again, I've seen websites that say, due to X political party, these are government websites, due to X political party, the website is down.
Yeah.
I've seen that.
Yeah.
So again, you want to go to a trusted source for information. Or call me.
I was
Well-
going to say as a joke. I was like, or just call Barry. I mean, what are
Call
we doing
me,
all these
and
papers?
I will tell anybody what I know.
Yeah.
Yeah.
We get stuff from the state, nonpartisan. I don't always trust the official stuff coming out of DC. Sometimes I'll trust it after I get through the first two paragraphs.
Yeah.
Right.
The first two paragraphs might have partisan stuff.
Right.
After that,
Get
you start seeing that
facts.
once you see
Yeah,
the
to get the
details,
factual
Yeah.
information.
then you can make a decision.
Yeah.
Well, that's why it's just important to call Barry, as I
Well,
said.
I mean, you used the words cut through the weeds. There's a lot of weeds nowadays, and it's hard to,
Yeah.
you know.
It can be confusing.
And you know what I wanted to? We've been talking a lot, obviously, about this enrollment period. But can you just tell people all the enrollment periods for each thing, so we actually know?
Okay, yeah. We can start with the initial enrollment period, which is 3 months before, the month of, and 3 months after your initial entitlement. So if you're 65, 3 months before your birth date, the month of your birth date, 3 months after. Glitch is if you're born on the first of the month, your Medicare starts the previous month.
Oh,
Because let's say you're born January 1st. You start your 66th year January 1st.
right,
Because no one's born a year old.
right.
So Medicare then will start for you December 1st.
Mm.
But for most people,
Yeah.
it's 3 months before, the month of, 3 months after. That's the rule.
Yeah.
But if you're born on the first, remember that.
Okay.
If you're on disability, you can get Medicare. It starts the first day of the 25th month that you've been collecting Social Security disability. And it's automatic.
Oh, wow.
If you're on disability, that comes automatically. Now, there are other enrollment periods. There's a general enrollment people. For people that don't take Part B when they're eligible, they can apply between January and March, and it becomes effective the first day of the month after they apply. There could be a late enrollment penalty of 10% a year for each full year after your entitlement. There's another special enrollment period for people that are working and covered by an employer group health plan.
That's me.
You have 8 months from the time your work ends or your coverage ends, whichever comes first,
Okay.
to apply for Medicare without a late enrollment penalty.
So 8 months after you've stopped working
Right,
without penalty.
right. And I tell people, even if you're working, take Part A
Yeah.
because that gets you in the system faster. And then you just need to apply for Part B with certain forms that we can send.
Right.
You know what I'm hearing here is that there's a lot of options. Like if you're a 64-year-old, I have a lot of people I know who are in that category, and they talk to me, and I'm not a Barry
You
Klitsberg.
hang out with a younger crowd.
Yeah, I'm lucky. I do have
He does.
younger people, and they ask, well, when should I get started? And I'm telling them, you probably should get started when you're 64, just so you know what's going on.
I tell people that people call us, I know I'm early, and I say, that's good.
No, yeah.
So you have information,
Right.
you know
Yeah,
when you
yeah.
need to do what.
Right.
Now, so the special enrollment, there's that 8-month period.
Yeah.
So this way you avoid the penalty for late enrollment. There's other enrollment periods, like you mentioned. We have the Medicare open enrollment season,
Right.
which is now.
Now, right. Oh, just about.
The information's live, but you can switch any plan you have. You can switch your drug plan. You could sign up new for a drug plan. Or you could sign up for a Medicare Advantage or switch your Medicare Advantage.
Is
or-
open enrollment start October what? 15th?
15th.
15th. Okay.
So you
So
can
that's
do
the same every
anything.
year. Yeah.
You could drop your plans, switch your plan, sign up new for a plan.
Got it.
You can
Until
do
what, December, it goes.
December 7th.
7th.
There's one other enrollment period. If you're in a Medicare Advantage plan, an HMO or a PPO, you have an additional enrollment period called the Medicare Advantage Open Enrollment Period, which is January 1st through the end of March, where you can switch your Advantage plan or drop it and go back to traditional Medicare. That's easy to do. But you can switch your Advantage plan and go back to Medicare or switch to a different plan. You cannot sign up anew for a Medicare Advantage plan. So if you don't have one, you can't sign up. But if you have one, you can switch it or drop it.
You know, we've bounced some terms around here, Part A, Part B, whatever.
Yeah.
Just a refresher
Yeah,
on
what the
Part
parts are,
A,
yeah.
Part B, Part D,
Yeah.
under Medicare, period, and then under Medicare
This
Advantage.
is an easy question.
Yeah.
Part A is hospital insurance.
Right,
That's premium free. So everybody who's
so that's
eligible for Medicare should take it.
right,
Because when you
why.
work and you have that 1.45% taken out of your salary for FICA tax,
Yeah.
that's your Medicare tax. That pays the Medicare trust fund.
okay,
Premium free. If you have 40 quarters, 10 years of work, which is the same rule for Social Security. Part B is medical insurance. That has a premium. And that covers doctors, outpatient or inpatient, durable medical equipment, ambulatory surgery centers, outpatient lab tests, outpatient diagnostic tests. That's all covered by Medicare Part B, 80%.
and that's where you need to get Medigap/supplement.
That's where a supplement can save you a lot of money. The
Right.
supplement can also save you from your Medicare hospital deductible. But that Part B, that 80-20 split, is even more critical.
Right,
Now you got Part C, which is Medicare Advantage, which I think we've kind of which we've talked about. We've kind of beaten that to death. We've gone over Part C, Medicare Advantage. And Part D is Medicare drug plans. D for drugs. So you have A, B, C, and D. Part C has low premium or no premium. Part D has a premium.
so you're gonna have, if you have Medicare
Right.
with Medigap, you're gonna have Part A, B, and D.
Right.
If you have Medicare Advantage, you're gonna have Part C, which covers A, B, and D.
Right.
Okay,
Now here's the
Otto,
thing.
Oh, boom. I don't know. That was
Good.
Now,
Was that
if you have
impressive?
Medigap, you get a separate card.
right,
So if you have Medicare and Medigap, you have A, B, and D, and a Medigap card.
right,
You give your Medigap card and your Medicare card to your provider. You give your Part D card to your pharmacist.
right.
You give your
I'm just gonna
Medicare.
show
Oh,
us
Otto's
Otto's
whipping. If you were
guide.
watching Otto on YouTube,
Demonstrate
he's
it.
whipping out all of his cards over there.
Medicare,
Never show
yes.
your Medicare card or your healthcare
Healthcare
card
Yes.
I'm
on
doing it
TV.
fast, I don't.
All right. Cover that number, because cover the number.
But you have 3 cards.
Yes.
You could have 3 cards. If
I-
you have a Medicare Advantage plan, you get your Medicare card, which you put away, and you only use your Medicare Advantage card when you go to the doctor or pharmacy.
Right, with the restrictions that we talk about
Right.
multiple times.
Right.
But otherwise, you could end up with 2 of these. No, you're gonna end up with 2 of these no matter
No
what.
matter what, you might have a
Right.
3rd card though.
Right,
Wow.
like I have 2 different companies.
And I can't stress enough not to do what you just did.
Yeah.
Because if you're watching on YouTube,
I know.
fast,
Yeah. I was like,
you can freeze
anyway.
your frame.
Yeah,
And I'm going to give you an
Yeah.
example.
cut that out, all right.
In 2012, during the Democratic convention, a woman flashed her Medicare card when a speaker talked about how Democrats gave you Medicare.
Yeah,
And I don't like to be political, but this woman was so happy she flashed her Medicare card. The next day,
God, she
there
got
were
scammed.
12,000 claims on
Yeah.
her Medicare number.
oh, wow.
Wow.
They had to switch her Medicare
You
number.
got that right there.
They froze her,
Yeah.
they froze her number
Dan, fix this.
so that they froze her number
Oh my God.
so that Medicare would not pay claims.
Well, you
Wow.
get a lot. We've had people on the show about Medicare fraud,
There's so much of that.
you know.
Oh my God.
And one of the biggest things I see as a problem, which is that they've encouraged people to not really know what's going on because they want you to go to electronic explanation of benefits.
Yeah.
And people have a tendency, and me included, that when you get an email that says this is your explanation of benefits,
Benefits.
you put it in this file over here
Right.
and you don't look at it.
Yeah.
When you get it in the mail,
Or you're more
you will
inclined
look
to,
at
yeah.
it.
Yeah.
The only way to avoid that, if you want an electronic record of your Medicare claims, either they'll send you that in the mail, or you can go to Medicare.gov and get a real-time version of your Medicare summary notice. But they will never email you a Medicare summary notice. You can download it because it's you.
Well, you get an email that says it's not
No.
Medicare, the insurance company.
Ignore it. Don't download it. Don't save it. Because
Right.
you tell them you want a hard copy, or unless they have a portal where you can go in and download it yourself.
Yeah, because somebody can send me one and says, you know,
And then you may make the mistake of clicking on something
giving
and
them
opening it,
information. Right.
and then they have all your information.
Mhm.
Oy.
So that's
10%.
one of the problems, frankly, as far as I see. You know, like if I saw a charge that I felt was out of the loop for Medicare, I would report it somehow, all right? But the problem is you don't see it if you don't, like they want you to cut off the paper, so you cut the paper off,
Right.
and now
right.
you have to go through the effort of looking for it,
Yeah.
and you may not do that.
You
I
can
like
print it
to
on
tell
paper.
people, I like to tell people, and I get this personally, I do some stuff electronically with businesses I know, but anything to deal with my healthcare, I want it where I can download it. I can review it. They'll send me an email, there's an update on
On
your
your
portal,
record, right, yeah,
Right.
yeah.
but they won't send me that update.
Update,
I
right.
have to download the update, and then but I want paper copies of everything from Medicare, from my supplemental
So you
plan.
get it in the mail
I
also.
get it in the mail because I use that for my
Yeah,
taxes.
to see that,
Yeah.
I'm gonna go back to that. to
And
be
if your
blunt
family
about it.
needed it for some reason too, like.
Yeah.
it's
Yeah.
Yeah, I'm
important to
gonna
have
go
that
back to
information.
that.
Yeah,
Yeah.
yeah,
Because otherwise, you know, like everybody, you get a lot of emails and you say, "Psh,"
Yeah.
yeah,
Yeah.
yeah.
you know, what can you get rid of?
The only email you may want to look at is to open a portal that
Right.
you have.
Yeah,
So
yeah.
you can then use your user ID and passcode,
Right,
which is secure, so you could then get into your information.
yeah,
Right,
But if
but that
someone says,
requires
click-
effort,
But that's different. They're sending you, there's an update.
right,
Yeah.
They're not sending you the update.
right,
right. But again, it requires an effort to do
Yeah,
that. You have to go
definitely.
to it,
Right.
to the portal.
but the
And-
effort's what's keeping
And
it
I'll be
safe.
willing to bet the percentage of people who do go to the portal, unless they have something really heavy duty going on, is low.
I get stuff when I go to my doctor for a physical.
Me too.
yeah.
They have
I need
electronic
everything.
health records.
My
and
chart, yeah,
Right,
My
so you
chart.
get something like that, but they just say there's an update.
Yeah,
yeah,
I can click on that, but then I have to enter my information.
right, right.
But just
I
make,
go to my chart, but I don't go to, you know,
good, don't do that.
yeah,
Gotta be careful with your Medicare information, your health insurance information, your social security number. They will send you, and a government source always sends you a paper letter.
well, we've heard stories like where you get you know, the raw end of the deal is if you wanted a wheelchair
Yep, and
with
you've
such
already
and
been
such,
billed, yeah.
and,
Oh, yeah.
and you apply for it, and they say, oh, you already
Yeah, you
got
already
one
used it.
last year.
That's an example, you must have heard me last year.
I did,
No, because that's an example I give where not only is it costly, it can interfere with your ability to get services or supplies in the future.
right, because somebody else already,
They already paid for it. It's got an expected
even if they
lifespan of
didn't get that,
expected lifespan of 5
Right.
years.
No, and I think it just goes into, you know, what we're always preaching on the show, that you have to be your own kind of advocate and aware of everything that, you know, and just pay attention, you know, because unfortunately we live in a place where these things kind of happen, you know, so it's just be aware. And I think, you know, obviously do not do what Otto did, do not flash your card.
No,
well,
and
Dan is editing.
just
Luckily, this is on.
just before you go, I want to repeat my number.
yes.
It's 516-485-3754. If I'm not at my desk, somebody is, and they're all certified and trained. I like most of them, and so, but they can answer your questions. And if it's something difficult or something out of the loop, they will leave me a note to call. And I'm in the office 2 days a week. I work from home one day, so I get messages all the time. Leave a phone mail
And he's
message.
always, I could vouch, he's always responding very fast. And of course, you can come to all these Project Independence
Yes.
programs to see Barry in the flesh. Barry, I would like to thank you so much. Such wonderful information.
Thank
Ninth
you.
time might have been the best time.
That's it.
You're listening to Project Independence and You on LIU Public Radio.